Welcome back to the channel. Today we're diving into one of the most groundbreaking books in psychology and trauma research. The Body Keeps the Score by Dr. Bessel van der Kolk. This book has revolutionized how we understand trauma, its effects on the body and mind, and most importantly, how we can heal from it. If you've ever wondered why traumatic experiences seem to stick with us long after they're over, or why traditional talk therapy sometimes isn't enough, this book provides fascinating answers backed by decades of research. Don't forget to hit that subscribe button and the notification bell. We're covering the most impactful psychology and self-help books. Before we dive into the book, let's talk about the author. Dr. Bessel van der Kolk is a Dutch-American psychiatrist who has spent over 40 years studying trauma. He's a clinical professor at Boston University and has treated thousands of trauma survivors, from Vietnam veterans to survivors of childhood abuse. What makes his work so powerful is that he doesn't just theorize about trauma. He's been in the trenches, working with real people and seeing what actually helps them heal. This book represents decades of clinical experience combined with cutting-edge neuroscience research. The core message of this book is right there in the title. The Body Keeps the Score. Van der Kolk argues that trauma isn't just something that happens to us mentally. It literally changes our bodies at a cellular level. Here's the key insight. When we experience trauma, our bodies go into survival mode. Our nervous system gets hijacked, stress hormones flood our system, and our brain's alarm system gets stuck in the on position. Even after the danger has passed, our bodies continue to react as if the threat is still present. This explains why trauma survivors often experience hypervigilance and being easily startled, sleep problems and nightmares, chronic pain and illness, difficulty with relationships and trust, emotional numbness, or overwhelming feelings. Van der Kolk shows us that these aren't signs of weakness or mental illness in the traditional sense. They're normal responses to abnormal experiences. One of the most fascinating parts of this book is how Van der Kolk explains what trauma actually does to our brains. He breaks it down into three key areas. The reptilian brain, brainstem, this is our survival brain. When we're traumatized, this part becomes hyperactive, constantly scanning for danger, even when we're safe. The mammalian brain, limbic system, this includes our emotional center and memory formation. Trauma can cause our emotions to become overwhelming or completely shut down. It also affects how memories are stored, often as fragmented images, sensations, or emotions rather than coherent narratives. The human brain, neocortex, this is our rational, thinking brain. Trauma can actually cause this area to go offline, which is why people often say they couldn't think straight during or after traumatic events. Here's the crucial point. Traditional talk therapy primarily engages the neocortex, the thinking brain. But if trauma has dysregulated the deeper, more primitive parts of our brain, just talking about it might not be enough. We need to work with the body and the nervous system directly. Van der Kolk doesn't dismiss traditional therapy, but he argues that it has limitations when it comes to trauma. He explains that trauma is stored in the body as much as in the mind, so purely cognitive approaches often fall short. Think about it this way. If someone has a panic attack, you can't just tell them to think their way out of it. Their body is having a real, physical response that needs to be addressed on a physical level. This is why Van der Kolk advocates for what he calls bottom-up approaches, therapies that work with the body and nervous system first, rather than starting with thoughts and analysis. The second half of the book focuses on treatment methods that Van der Kolk has found most effective. Here are the key approaches. EMDR, eye movement desensitization, and reprocessing. This involves recalling traumatic memories while engaging in bilateral stimulation, often through eye movements. It helps the brain process and integrate traumatic memories. Yoga and mindfulness. These practices help trauma survivors reconnect with their bodies in a safe way and learn to regulate their nervous systems. Theater and movement therapy. Creative expression can help people process trauma when words aren't enough. Neurofeedback. This technology helps people learn to regulate their brain waves and nervous system responses. The common thread in all these approaches is that they work with the body and nervous system, not just the mind. They help people learn to feel safe in their own bodies again. van der Kolk emphasizes that healing isn't about forgetting or getting over trauma. It's about learning to live with it in a way that doesn't control your life. IFS, internal family systems. This approach helps people understand and integrate different parts of themselves, including parts that may have been created to cope with trauma. So what can you take away from this book, even if you're not a trauma survivor or therapist? 1. Listen to your body. Our bodies are constantly giving us information about our emotional state. Learn to pay attention to physical sensations, tension, and energy levels. 2. Breathing matters. Simple breathing exercises can be powerful tools for regulating your nervous system in moments of stress. 3. Movement is medicine. Regular exercise, yoga, or even just dancing can help process emotions and stress that get stuck in the body. 4. Safety first. Healing requires feeling safe. This might mean setting boundaries, finding supportive relationships, or creating calming environments. 5. Be patient. Healing from trauma takes time and often requires professional help. There's no quick fix, but there is hope. Van der Kolk's message is ultimately one of hope. He shows us that even severe trauma can be healed, and that our capacity for resilience is greater than we might think. The Body Keeps the Score is more than just a book about trauma. It's a roadmap for understanding how our minds and bodies are connected, and how we can work with both to heal and thrive. Whether you're a trauma survivor, someone who works with trauma survivors, or just someone interested in understanding human psychology better, this book offers profound insights that can change how you think about healing and resilience. If this summary was helpful, please give a thumbs up and let me know in the comments what other psychology or self-help books you'd like me to cover. And remember, if you're dealing with trauma, please reach out to a qualified mental health professional. Thanks for watching, and I'll see you in the next video.